Welcome back, ladies and gentlemen. We are talking about probability and distribution in medical statistics, and this part is specifically about independence. So we are going to talk about independent variables, dependent variables, and we're also going to take a look at the examples of these variables, and we're also going to talk about the importance of independence in terms of probability and medical statistics. So independence is in terms of data or the variables. So the data can have a different type of variables. Some of them can be independent and some of them may be dependent. So many statistical procedures assume that the data points in a sample are independent of each other. So we should be aware when we're analyzing the data that which variable is independent and which one is not, because that may affect our statistical analysis. If we have two values which are independent of each other, then this means that knowing that something about one value tells us nothing about the other. For example, we have a variable A and we have a variable B. They are not related to each other in any way, and they are not dependent on each other in any way. So changing the value of A would have no effect on the value of B. Similarly, changing the value of B would have no effect on the value of A. Moreover, if we know that there has been a slight increase in the value of A, so that would give us no information regarding the value of B, because they are not related to each other and they are not depending on each other. So that brings us to the two types of variables, the independent variables and the dependent variables. So independent variable, as the name suggests, a variable whose variation does not depend on that of the other or another. So if we have a variable, so for example, if I take the example of skin color and height, so if I change the skin color, it would have no effect on the height, because height is entirely independent of the skin color. So these two variables are not depending on each other. The depending variable, on the other hand, as the name suggests, is depending on some other variable by which, for example, if you can change one variable, it would have an effect on another variable. So two variables measured within a sample of individuals may be related to each other and so are not independent. So this dependency can be of two types. It can be of the sort that one variable is independent and one is dependent. For example, height. If we increase the height, then the BMI, if we increase the height, then the weight also increases, because weight is dependent on height, but height is not independent on weight. So if we increase the weight, it is not obvious that height would also increase. So this is a relationship in which one variable is independent and the other one is dependent on the independent variable. But sometimes it may also happen that the two variables may have an association and they may be depending on each other. Like for example, if there are two variables which have a direct proportional relationship with each other, so increasing one variable would automatically increase the other. So that type of relationship can also occur, and in this case, both of them are the dependent variables on each other. Often the case that variables are related to each other when we are talking about research, and for example, as I gave you the example that weight is dependent on the height. Similarly, gender is an independent variable, but weight is depending on the gender as well. For example, males have a greater weight as compared to females. When we use these dependent or independent variables in medical research, we have a purpose for it. So when we are using dependent variables in medical research, we are using them to test a hypothesis and determine risk factors for the disease. For example, a certain independent factor can affect another factor, and that can actually determine the risk of disease. Or similarly, we can also use to find correlation and association between two or more variables in the research and working upon our hypothesis in that aspect. So let's take an example on the independent and dependent variables. So to determine if the amount of exercise an individual takes is related to their weight. Now here exercise and weight are two variables. Now exercise is an independent variable and weight is a dependent variable. So we are actually testing a hypothesis in which we are actually testing if exercise has an effect on weight. If it has, then exercise is the independent variable and weight is the dependent variable, which is depending on exercise. And that is how we can use dependent variables in different type of research situations in medical research. Moreover, if exercise and weight are found to be related, we may decide to investigate whether increasing the amount of exercise taken may reduce weight. Now, once we are aware that weight is dependent on exercise, we can also find the direction of that relationship. For example, if weight and exercise are directly proportional or inversely proportional. So if I say that increasing the amount of exercise decreases the weight, then I can say that there is an inverse relationship between exercise and weight. So let's take another example which is out of the context of the medical, but it is a very easy example so that it would be easier for you to understand the true concept of independent and dependent variable. So here we have an independent variable, for example, amount of water. So if we give a greater amount of water to a plant, then there is a chance that there would be a better growth of the plant, and the plant that receives the greater amount of water would have a greater height. Similarly, fertilizer is an independent variable, so the amount of fertilizer that we use is independent, but the amount of fertilizer that we use will have an effect on the height of the plant. The greater the amount of fertilizer is used, the greater would be height of the plant. So the height of the plant is the dependent variable, whereas the amount of water given to the plant or the amount of fertilizer given to the plant is an independent variable. Now there is another way of looking at the independent or dependent variable. For example, here we have an example in which we are giving a medication for, let's suppose, some certain type of an allergic reaction. So that medicine decreases the histamine level and level of drowsiness. So if one pill is given to the person who has that allergy, so that would decrease the effect of that allergic response. So giving a greater amount of medication would decrease the effect of the allergic response further. So we can say that increasing the dose of medication would result in increasing the dose of medication would result in decrease in the allergic response. So there is a reverse relationship. And on the other hand, increasing the dose of the medication in this scenario is increasing the level of drowsiness. So we can say that drowsiness or the level of drowsiness is once again dependent on the dose of the medication, and there is a direct relationship. Now, why does independence matter? Because it is very important to analyze and realize that which one of the variables are independent and which are dependent, because the analysis and interpretation of the results and data depends on that. And if there is confusion or if there is mismanagement of the variables, then the conclusion and the results would be affected as well. So if we treat data as if they are independent when they are not, we can make incorrect statistical inferences and deductions. So let's take an example to understand that. For example, we have a pool sample in which we are conducting study, and we want to find out the mean height of all the mothers in the sample or in the population. So that is simple. Like, for example, if we take a simple population, so we take the mean height and if we take the height of all the participants and then we divide by the total number, we get the mean height. But here it is possible that shorter women may have more babies than taller women. It's just a supposition. So if in case shorter women have more babies than taller women, so we can see in the analysis that their average height or the mean height would be smaller than it should be, because shorter women are getting pregnant more as compared to taller women, and thus they are having more babies, so that can affect the overall mean height. So we can say that having babies and height is not purely independent of each other. So because some shorter women would be included more than once, and secondly, more shorter women would be getting pregnant and they would be included in the data. So once again, the height would also be not the overall mean height would not be the true representative of the population. So that is a way in which the independence, when not truly analyzed and interpreted, can affect our inferences. So that was all about how it impacts our inferences, and it is important to take any data dependence into account when designing and analyzing data. Look at all the aspects of a variable, that on which variable it is dependent, and then decide if it is truly independent or not. So that was all about the section number 1 of this lecture, which is about the probability and distribution. I hope you learned something new out of it. So keep on watching sqadia.com for more lectures like this. Thank you very much.